Meet Daniel Phelan. Danny is a type 1 diabetic. He was diagnosed young, 7th grade.
I was diagnosed in June of 2002. I got very, very sick and no one knew what was happening. My doctor did the urine stick sample, and when she did it, it came back for glucose being in my urine.
Danny was lucky. Not only is he a diligent patient who studied and worked hard to manage his diabetes, he's had the advantage of good medical care and the latest technologies.
What I had to learn about managing diabetes from the beginning was completely new. You know, I had to learn everything from scratch. And one of the things that kind of gives you an idea about what's happening with your blood sugars is, you know, the A1C test. And when I first started getting the A1C tests, they were somewhat high. I didn't know that a lot of the time my blood sugar was spiking that I didn't know about. I was testing 4, maybe 5 times a day, and that's 4 times out of 24 hours. There's a lot of uncertainty in there. There's a lot of stuff that I did not know was going on with my body.
Seemingly in control, Danny's A1C number had become stable, remaining in a good range with acceptable fluctuation.
The A1C was the only test I had to let me know over a 3-month span what was happening, what my blood sugar was doing, where it was going, was I always high, was I always low? I didn't have any other way other than that number.
Still, something was missing, that final tune-up. Danny's doctor, Michael Shanik, told him about the GlycoMark test. The GlycoMark test helped Dr. Shanik determine that Danny was having postprandial glucose spikes, fixable by a simple timing adjustment of Danny's insulin, a seemingly minor modification with a major impact.
And he said, your A1C is an average of what's going on, for 3-4 months. But this test, he said, is gonna let you know what's happening when your blood sugars are spiking. When he came back, he said that you are having spikes. You're spiking post meals often. We figured out that I was giving myself insulin at the wrong time. I was giving it too close to when I was eating. So between the GlycoMark test and the CGM, I figured out that my blood sugar was spiking post meals, and I was able to correct that.
We asked Danny's doctor, Dr. Michael Shanik, to discuss the difference GlycoMark made in understanding and controlling Danny's glucose levels.
I tried to explain what the test meant, that it was a short-term marker of blood sugar control, and that it might help us evaluate not only short-term but even variability in patients who have reasonable control.
Through what we learned from the GlycoMark test, I was able to learn that I needed to give myself my insulin. Either, what I first started doing was at the time that I was eating, and then we further discussed the test even further, and it had gone up a little bit, but I started to also see that there were still a little bit of spikes. They weren't as high as before, but there were still small spikes in my blood sugar post-meal.
For me, I think what was important about this with Danny is that his A1C was good, and had I not run the GlycoMark, I would have been very satisfied. I would have said, you're doing great, keep up the good work. I know Danny's very diligent about checking his blood sugars, recording them, looking at his food and his meals. And when we saw that, I kind of thought, well, maybe there's something else to this, to the glycemic control, especially looking at a 3-month average gives you a big window of time. So the GlycoMark kind of helped us. And
like I said, I can see on my CGM, along with the GlycoMark test, I could see what was happening, and now I've eliminated the spikes in my blood sugar post-meal. And what that's done is not only do I feel better, but my numbers are incredibly good.
GlycoMark. It's what you don't know.